Good evening, friends. Meeting again with the practical part of the organ of medicine, and we have started discussing about the aphorism number 83. And since 3 days, we are on 83. This is the, in fact, joy of learning the practical part of organ, because we used to remain on one sentence for 2 days, 3 days. There is many more things which we can learn, and this is what is called as philosophy of organ of medicine. So we have started discussing about the qualities of the homeopathic physician and four important qualities in order to take a chronic case, which Hahnemann mentioned in this sixth edition of Organ of Medicine in the aphorism number 83. The first he explained over there that the physician should have freedom from prejudice. The second important point which he has explained about the sound senses. The third important thing, the attention in observing, and fourth one today which we have to discuss is the fidelity in tracing the picture of the disease. The every quality we have discussed in detail. The first one which we have discussed, that is the fidelity in tracing the freedom from prejudice in detail, because it is too difficult to become or to get unprejudiced. Very difficult task, and one has to acquire it. How to acquire, how to go ahead, those things which already we have discussed. Second important point, sound senses. The out of 5 senses, 4 we have discussed, one is not required, and third one, that is the last sound sense, that is called as sixth sense, which also we have discussed. Then the third one, attention in observing, already while discussing the sound senses, the observation, that also we have discussed. So there is no need to go with that. Today we have to concentrate on the last point, that is fidelity in tracing the picture of the disease. Fidelity means the words the patient has used, in the same words it should be written as it is. This is what Hahnemann wants. This is what is called as fidelity. In Marathi, we call it tanto tantapana, as it is. Why it is necessary? Why to write down each and every thing? Because record keeping is one of the very, very, very important thing which is needed. This record keeping guide you for the further follow-up. Once your patient comes for follow-up, if you have a whole record, you can go through each and every sentence and you can ask accordingly. Actually, follow-up should be like that. You should go with the previous record, find it out each and every detail, and then ask regarding the follow-up. Then you can find it out what's good and what's not good. It is not like that if the patient is feeling generally better, that's all. It's not like that. You should not just within a second you take follow-up and you prescribe. It should not happen. And that's why Hahnemann says that if you write it down in a perfect manner, it will be better for you to go ahead in follow-up. So fidelity is one important thing, and this you should take down when you write down the cases. Even though you should have that speed to catch each and everything, the sentence used by the patient as it is. The sentences make the difference, because it is not only the sentences, the way it has been uttered by the patient matters a lot. This is very important, because sentence remains to be the same, but the emotions behind those sentences are different. It varies. For example, if I use the sentence, what is wrong with you? What is wrong with you? What is wrong with you? The sentence remains same. The man behind the sentence is different. And if you understand this man behind the sentences, behind the symptoms, it is necessary. And that's why Hahnemann says that write it down in the same word. The fidelity should be there along with the emotions. If you can write it down in bracket, that will be better to understand how the patient has behaved. So it is not only the sentences matter. Along behind that, those sentences, a man matters, because we have to treat man, not only the symptom. So when you write down the symptom of the patient, you write down what are the different emotions with which he has expressed the thing. Write down the location, write down the sensation, write down the modality, write down the concomitants, write down all the mental state along with that. That gives you exact idea of that patient. Yes, this is the patient. Just I'll share a today's example. Today, my one of the student who has taken case, and I have seen that patient later on when he took the case, and then we have where I have prescribed him a calcarea silicata or calcarea carb. I think I have prescribed him. We have done the repertorization, and the second remedy in repertorization was plumbum. He asked why you have not selected plumbum, why you have given the calcarea. What is the reason behind that? The answer was that behind his symptoms, the man was calcarea, not the plumbum. Plumbum is the person who has the sclerosed condition. Plumbum is the person where is the degeneration. The plumbum is the person where there is syphilitic miasm. The behavior is like attack and defense, as explained Sir Shankaran sir in a nice manner in Soul of Remedy. The expressions of the patients are rather different in plumbum. Plumbum goes way beyond, and calcarea is absolutely different. Calcarea is taciturn. Calcarea wants to remain some in company. Sometimes he never wants to talk too much. He is comparatively mild, a cowardice. He is insecure. He's not like a plumbum to fight with the things fast and hard and enough. It is not like that. You have to treat that man. You don't have to treat the symptom. And that's why when you are selecting those things, you have to understand the man behind that. And this is the expectation of Hahnemann when he writes down the fidelity in tracing the picture of the disease. This is what we have to get. So see, these qualities are very important, which guides you to become what you have to look for. You have to find it out what exactly the things which you have to look for. And these are very, very essential qualities one must develop. No one is born homeopathic. But everyone is born with logic. Everyone is born with intellect. Everyone is born with memory. Everyone is born with will. Everyone is born with understanding. All those things creates you a homeopath if you develop this quality. And to develop those qualities, you have to work hard. You have to learn, and you have to learn what Hahnemann have said in the sentences, in the way he has expressed in the aphorism. Those we have to understand. And this is what is the 83 aphorism, that in order to take a chronic case, you develop all those four important qualities, which matters a lot, then you understand the human being. And once you understand the human being, your prescription always becomes very clear. You are damn sure, yes, your remedy will going to work. You have to understand that. Don't go only with the symptoms or the just the sentences. You have to understand the man behind that. So this is what the 83 aphorism. So we have finished the 83 after 3 days. Now we have to go with the 84. From 84 onwards, he has explained all the do's and don'ts of case taking. Every sentence in it has a meaning. Every sentence. So you have to understand all those things. You have to understand what exactly he means by that sentence. So we'll start with the aphorism number 84. The patient details the history of his suffering. The first sentence, that who will going to give you history? The patient himself. Main source of your case taking, the history, is the patient. So he details you. Only thing is that your question should be appropriate. It should be very appropriate. If you ask it properly, patient starts detailing, patient gives you details. So forming the question is a very important entity. When you deal with the chronic cases, your questionnaire should be very clear. And that's why you have to work hard. You have to think before questioning. And make a habit of how you will going to put your question so that patient will narrate properly. So the patient details his history of his suffering. Those about him tell what they heard him complain of. So those are the attendants along with the patient. Those will give you what the patient what they have heard about the patient. So they will give you two things. First important thing, they will tell you what they have heard of his complaints, what he is complaining. That part he will going to, the attendant will going to give. And one more thing, the attendants will going to give how he has behaved. Second important thing, which in the information, that how the patient is behaving during the illness, that is also supplied, that information is also supplied by the attendant. And third important thing, and what they have noticed in him, and what the attendant have noticed in him, that is the third thing they will going to tell you. See, these are the very important three entities which are required for your case taking, because you have to individualize, because you have to find it out, man. And that's why, yes, patient will going to tell you the certain history, but don't be 100% confident what about the patient, because whatever the patient has told, never consider that whatever he has told is right. Whatever he has told is the truth. Many times patient tries to hide the thing, and that's why never believe 100% about the what the patient is telling. You have to confirm it. Attendant is the big source with whom you can consult and you can ask for it. He will going to tell you yes, all the details. So if you are dealing with the patient, for example, I will share one example what has happened. What happened when I was taking the workshop on day one, there was I used to make a group of 4 students. The one is leader and rest of the 3, they have to learn, and one case behind every 4 students. On day one, the group leader takes the case, and next rest of the 3 days, everyone gets a chance to take a new case. So on day first, one group leader, she brought the whole case along with the 3 students and patient in front of me. And sir, this is the case I have taken. And sir, give her Barata cup. That's all. 100% Barata cup. She has not uttered a single word during case taking. We have tried our level best, but she has not even explained her name. She is so shy. She is so timid. She is so obstinate. Don't give any. She is so timid. Don't give him. No, please give her a Barata cup. She was quite confident. And she was expressing, this is what Barata cup is. What happens generally, the yes, child might be shy, but it is ultimately an art which you have to develop. What I have done, when they were sitting in front of me, I took the globules and I have provided. Yes, do you want it? I asked the child. She said yes. I have given the 4 pills. After 1 minute, again I asked, do you want more? She said yes. Asked, then tell me your name. And she told her name. Then I asked, I have given 4 more tablets, 4 more globules. Then I asked, what is your problem? And she started narrating. Finished. Where is the Barata now? This problem arises because case taking is an art which you have to develop. It is an art. So ultimately, you have to deal with that. So whatever you get the information, always confirm it. You ask the patient's attendance. Is she really shy? Is she really timid? Is she never wants to answer? All those things which are necessary. This guides you toward perfect remedy. Otherwise, you don't. And that's why attendant is the big source between for getting the information. So attendants will going to give you 3 important things which he has explained over there. The first thing, what they have heard patient complaints of. Second important thing, that how the patient was behaving. Second important thing. And third thing which he explains over there, what they have noticed in the patient. These are three important things the attendant will going to give you. And then comes the role of physician. So see, three important persons in the case taking are the patient himself, the attendant, and third, the physician. And what he says over there, the physician sees, hears, the physician sees, hears, and remarks by his other senses what there is of an altered and unusual character about him. See, this is more important. Out of these three, first and foremost important is the sound senses of physician. What he notices when he looks toward the patient, what he sees. The eyes should be cleared, vision should be clear, and it should be with keen observation. The perceiving thing should be there. So he immediately notices what is wrong with the patient, how the patient is, how the patient is behaving. If you are going to visit a patient and patient is sitting over there, a patient of asthma, and you are called at night at 2 o'clock or 3 o'clock in the night, and you went for visit and you have seen that patient is sitting over there, bending forward and keeping hands like this, and there is severe breathlessness. This is what which is very important for you. You ask the patient to lie down. Patient never says no, not at all. I could not. Your eyes should be very clear. Yes, what you are observing, this position, asthma, better by bending double, bending forward. Very important. At 2 o'clock or between 2 to 3 is the Kali Carbonicum. What a patient's physician sees is very important. The another patient, when you see another patient, you go for the home visit and patient is lying like this there, and he is lying and he is asthmatic and he is having breathlessness, and you ask him to sit down, he says no. After sitting down, I get aggravated. He lies in that position, he is happy. Then remedy becomes it depends upon the it explains the things immediately. It gives you a remedy. Which is the remedy? Asthma better by lying down with hands wide apart. Yes, Jyoti, what she has said is very correct. It is Sorayanam. So you can catch that. That power, that penetration of a power should be there. That immediately you should catch. The patient is sitting in front of you. The child is there. The child is doing this continuously. You must catch. This is very important. There are some children who used to do this. So nose boring of nose, finger with the fingers. The second child biting the nails. Another child keeps the two fingers or thumb inside the mouth. Fingers put in the mouth, children must. Another rubric. You get all those things. It depends upon you how you catch it. This is too important to understand. Very important in fact. And this is what he wants to explain over there. What patient physician sees. This is first important. Many things you can see. You can see the constitution, you can see the attitude of the person, you can see and watch, yes, how the patient behaves during consultation, how he enters inside the clinic, how he enters inside your clinic room. Everything you are going to observe. And those things matters a lot, because that will give you idea about that human being, not about his illness. You have to prescribe not for the illness, you have to prescribe for the man. And that's what you have to watch. What he hears, that is also important. That also we have discussed while discussing the sound sense. His ears should be very sound so that they can listen what is going on outside. How the person was behaving, how he behaves with the reception. Immediately you can catch those things, and which guides you regarding the nature of that individual, because you have to treat him. And remarked by his other senses. What is other senses? All those which we have discussed in detail with the sixth sense. And you have to catch, yes, how this person is like that. This is your sense. You catch it. With the sentences, the way he utters is very important. And that's what you have to catch. Remarks by his other senses, what there is of an altered or unusual character about him. Altered or unusual character about the patient. What is the altered character? So person who used to behave normally all of a sudden comes to you in a panic state. And he is there sitting in front of you. Doctor, please save me. This is troubling me a lot. Immediately you give medicine. Immediately, yes. It should stop immediately. He's in agony. He's in agony. He's having very severe pain. The way he is behaving, this is what you have to catch. What remedy you will think? Any idea? Any rubric? Why opium? It is not a fear extravagance. It is not fear. Yes, what patient is
Shrieking for help.
shrieking for help is uh, okay, but he is seeking for help is little bit thin. What he wants, what he expects from you. Carried desires to be carried fast, agreed, but what he is not only fast, he wants it instantly. He wants it instant. The doctor should treat him or stop his pains instantly, the moment. The only remedy, single remedy, is chamomilla. Chamomilla. This is chamomilla. Doctor should treat him at the same time. Only chamomilla. This is what you have to watch. You have to watch, understand, and immediately you have to perceive. Then you reach to the right remedy. You have to differentiate. If the same patient comes in a different manner, he comes to you and he explains, doctor, save me. I will going to die. Just it's too much troubling. Just I will die fast. Now the themes are changed. Now he is predicting the death. He is having the fear expressing on his mind face. Now it becomes aconite, not chamomilla. Those things you have to differentiate. And this is what with the sixth sense. You have to mix all the senses and the perceiving with which you can find it out, right remedy. This is very important, essential. But this goes in relation with the acute. Chronic, you have to listen. Listening is a very important quality because listening gives you many things. If you start listening properly to the patient, develop a art of listening, you will get many female patients in your opinion. Because no one listens to them at their home. So they find it out a good homeopath who listens and you get the female patient. This is quite common. Listening gives you understanding about the patient and make a habit of listening with thinking. The way patient presents, everything, whatever patient presents matters a lot. So the sentences which he utters, the way he wants to explain, you will going to get all those things. And the tone of the voice. When patient narrates, what is the tone? How he behaves with his attendant, how he behaves with you, the way he sees, all those things matter. This is what the physicians, in fact, knowledge comes at that time. And this is the case taking which the Hahnemann expects. This is what Hahnemann expects. Then it becomes rather simple for finding it out a right remedy. Otherwise, it never becomes a when you go with the symptoms only, you cannot reach to the right remedy many times because you never find it out the right person behind them. And this is what is Hahnemann expects from you. So Hahnemannian concept of understanding, the human being during the chronic case taking is finding it out, all those, all this, the nature of the person and the way patient narrates. So what he has said, that what there is of an altered or unusual character, unusual character. The person prior to the case taking, yes, he might be your friend, and you have observed him every time. He is very jolly, very much talking everything and enjoying. And the day he enters in your clinic, he is absolutely mild, he is absolutely serious, he is very, very, very disturbed looking. Immediately catch it out, something is wrong. This is not his nature. Immediately you catch something is wrong with the patient. What your question should be, what's wrong with you? You use this talent and logic in your day-to-day life. When you meet your friends, if you find it out, you perceive that something is wrong, and immediately you put question, what is wrong with you? The same thing here you can use with the patient, and you can catch those unusual things, altered character, which you can find it out with the patient. So the three important persons who will going to give total information about the patient. The first one is the patient himself. The second one, attendant. Attendant will going to guide you regarding three important things, what he explains over there. Whatever they have heard patient complaining of, they will narrate. Second important, how patient's behavior, they will going to tell you. And third important thing, that what they have noticed in the patient, that also they will going to guide you. And third important person and most important is the physician himself, because he himself observes that patient with his own eyes. He listens whatever the patient will going to tell him, and with his sixth sense, he judge. He is the good judge during case taking, and that's why whatever necessary information in order to understand that human being, he will going to do. So we'll stop over here only, because next sentence has a lot of meaning again, that we'll discuss in tomorrow's session. So till that period, thank you very much, and we'll have a question answer. 5 minutes are there with you. So any queries, any questions, if there are, we can discuss. No questions? Everyone knows all those things. Question should
Sir,
be there. Bol.
sir, I have a doubt.
Yes.
Sir, on Friday session, we discussed, sir, we should not give more importance to the diagnosis or nomenclature of the disease. But in emergency condition, today I had a case, sir, left ovarian cyst with torsion. Patient is complaining of more pain. Gynecologist referred for surgery, but she is only 27 years old, sir. She is not at all interested for surgery. She is very panic. They advised for hysterectomy, pan hysterectomy, but now she is having pain, severe pain abdomen. Analgesics gives only a momentary relief, but she wants permanent relief. At this time, how to handle her? How to handle this situation, sir?
Yes. You have listened half truth of that sentence. What we have discussed on Friday session, that diagnosis is not important for the purpose of prescribing innovative. Diagnosis is important because we have discussed both the things, knowledge of disease as well as knowledge of indications. Aphorism 3, we have taken the reference of
Yes, sir. Yes.
aphorism 3, and we have discussed both things. Knowledge of disease is very, very important in order to understand the patient. But for prescribing point of view, it is not useful for you. Because diagnosis is commonly made on common symptoms. And common symptoms will not going to give the individuality of the person. So in such a cases, no doubt, you have to diagnose. What may be the reason? What is the problem with the patient? You have to first diagnose. Immediately, logic should work. What was her problem with which she was complaining? What she was complaining?
Sir,
What was-
lower pain abdomen,
And
lower pain abdomen,
uh,
and mild nausea.
nausea.
This is the main complaint she is repeating, but no other fever, vomit,
Uh,
no.
Okay, but my question is that why she has advised pan hysterectomy?
The cyst is getting growth, sir.
But it is
Cyst
not
is
an,
getting become.
this is not an acute emergency.
Hmm.
If it has been ruptured, it can be emergency. But that
Okay,
you have
sir.
to diagnose. You have to ask the patient to go for USG.
Oh, okay, sir. Okay, sir.
You have to ask whether if you feel that there is a tenderness on the abdomen, and second important thing, it becomes rigid absolutely. There must be some pathology inside the abdomen. You have to diagnose that by any means. You have to differentiate whether it is a true surgical condition or whether it is just a acute pain in abdomen.
Okay, sir. Okay,
Definitely,
sir.
your logic will definitely work on the basis of diagnosis only, but treatment, your part of prescription never depends upon it. You are not going to decide a remedy on that. Your remedy will
Understood.
depend upon the patient's characteristic feature.
Yes, sir.
For example, a patient comes with acute pain and she is complaining, yes, I'm having very severe pain. She's bending double and she's pressing it very hard. Then you must observe this instead of diagnosing. Yes, instead of diagnosing, with the help of diagnosis, you will not going to get remedy. This is what which will going to give you colocin. So your remedy never depends upon diagnosis. Your remedy depends upon the symptoms, characteristic symptoms, and your diagnosis is too important to think logically whether the remedy, whether you have to go for medicinal treatment or surgical treatment.
Surgical treatment. Yes, sir. I understood the differentiations.
Okay. So thank you very much being there. Hardik, any question?
Sir, can we confirm every time when we prescribe the remedy sphere of action? Sometimes sphere of action is not there.
No, I could not understand your question.
जब हम कंस्टिट्यूशनल रेमेडी प्रिस्क्राइब करते हैं पर वो स्पीयर ऑफ एक्शन कवर नहीं करते वो जगह तो मेडिसिन प्रिस्क्राइब करते हैं.
What remedy you are prescribing, that matters a lot. Second important, if it covers the whole generals of the case, and if it never covers the particulars, it doesn't matter, but it should cover all the generals. If it covers the generals, yes, you use that, even though it is not mentioned under the particular, but it should be confirmed. Yes, all generals explaining about the same remedy. Okay.
Okay.
So thank you very much for attending session. Tomorrow we'll meet at the same time and session will be definitely there. Okay. Thank you.